important topic. El Nino explained why the current climate crisis is a health crisis. I'm Tolenyata, an Internews pandemic health mentor, and Internews is one of the members of the media task force for the Eastern and Southern Africa Interagency Working Group for Risk, Communication and Community Engagement, RCCE. They are the folks who are leading the group that's hosting this particular event. It had to emerge in a time when there was a good amount of denialism about climate change. I know you remember that. But now, everywhere we look, everywhere we see, we have the impacts which are very much felt in our region. Climate's impact on health is an urgent story, as our speakers will highlight. It has been said, climate currently is the most important issue and the story of the 21st century. And how climate change impacts our health is what we will be discussing today. Recently, a report was presented in Davos titled The Consequences of Climate Change for Global Health. It shows how climate change threatens several million deaths in the coming decades. It's also causing an uptick in serious illnesses, all at a very high cost to the health system. In East and Southern Africa, the impacts of the 6 key consequences highlighted in the report are already there. We can see them all over. The floods, the droughts, heat waves, forest fires, tropical storms, and cyclones such as El Nino, which we'll be discussing today, are witnessed all across the region. At COP28, which was held in Dubai in the last December, this issue was trending and received much more attention than in any other COP event before. A record number of health ministers attended, emerging 65 of them, attended COP28, together with academia, climate activists, and they all called for urgent climate action. And we are seeing more and more climate and health. There is a nexus. So in all these conversations, where do journalists fit in? We are so fortunate today to be joined by an eminent panel, which includes Eunice Koech, who is coming from IGAD Climate Prediction and Application Center. Eunice is a climate modeling specialist at ICPAC, based in Nairobi, Kenya, and her current focus is on seasonal and subseasonal statistical climatic forecasting for the Eastern African region. She is also passionate about communicating climate information to users who have no background in climate science like ourselves. And also her interest is, and professional goals is to include or to be a bridge between the climate providers and users to ensure that climate information uptake and use is increased in the region. We are also joined by Dr. Solomon Fiseha from the World Health Organization. Dr. Solomon is a medical doctor with experience in public health for more than 15 years and has worked for the Ethiopian government, Red Cross, and currently the World Health Organization. He has experience in working on public health emergencies, disaster management, and has been involved in responding to a number of crises, including drought and food insecurity response in Ethiopia in 2022, the Ebola outbreak, the Marburg outbreak, the Lassa fever, cholera, meningitis, yellow fever, among others. He's also responded to natural disasters such as cyclones in Mozambique and Philippines. And also, he has experience in responding to
I think, have we lost Tole's connection?
Yeah, apparently it seems like it.
He was talking about Yes.
Um,
So Tole was talking about Dr. Solomon's experience,
yeah.
and yeah, he's a health emergency expert at the WHO. So Dr. Solomon, we are so excited that you're here because your experience and of course what the WHO's insights bring to this are very important for us journalists. So thank you very much for that. And I'm Ida Jooste. I'm with Internews as well. I'm not sure, has Tole already introduced Alois Urasa? Can you just
No.
remind? No. Okay. So I will also introduce Dr. Alois Urasa. I'm just filling in for Tole, everybody. I hope that he'll be back soon. Dr. Urasa has vast experience in looking at this issue of the intersection between climate and health. He's actually a malaria expert. And if you followed the release of the World Malaria Report on the last day of November last year, there was a very specific mention of climate's impact in terms of how malaria is presenting in new places and in new ways. Dr. Urasa is also a youth activist, in other words, getting the youth involved in understanding just how serious this issue is. So we appreciate you joining this discussion, all of you panelists. Thank you very much. So I think, we were going to start with you, Dr. Solomon.
Sorry, hold on. Can I just introduce myself as one of the
Yes,
speakers?
of course, Adele. Sorry about that, Adele. Yes, please do. Adele from Internews, please introduce yourself, and then you take it over, please, and pass to Dr. Solomon. Thank you, Adele.
Okay, I just thought I would add the introduction, then it's done and we don't have to go back here. So my name is Adele Belletta. I am somebody who is a journalist. I've been a journalist for over 30 years. I'm a science writer. And I'm currently working with Internews and, sort of getting into discussions, wonderful discussions with journalists. How do we cover stories? How do we tell the stories? So today I'm going to be looking at this interface between El Nino, climate change, and health. And we're going to see what are the best ways of telling the story. And I'm hoping that we can have a real juicy conversation about what are the things that are difficult for us as journalists? And so that we can just have a really great open conversation about things that hinder us, things that work for us, and also to create this wonderful sort of sense of networking. We have great people today that are speaking, Eunice Alois and Dr. Solomon. So already there, we've got some sources for you. And long may we continue to write and to do what we need to do in this incredibly challenging job. So speak to you later. And I hand over to Christophe, I think, who will, or is it Dr. Solomon? No, not Dr. Solomon. I think we're going to have Eunice. Eunice, yes. Could you please kick off the discussion? Thank you so much and welcome.
Yes, thank you so much, Adele. Thank you so much, Ida. And good morning, good afternoon to our audience. It's a pleasure having you this afternoon from Nairobi. And like Tole has already introduced me, I'll just go direct to what we're going to talk about today. And we basically want to understand what drives our climate and instances where we misinform the public, what happens to them. A brief outline of what I'm going to share with us is what we do as ICPAC, give a very brief explanation of what climate drivers affect our region, especially in terms of rainfall, then a bit of miscommunication of climate information, especially coming from a region where this is rampant, and just a bit of how do we ensure that we avoid miscommunication of climate information. So ICPAC is a regional climate center that serves more than 300 million people over Eastern Africa. It was established in 1989 as a drought monitoring center. This was basically after a series of droughts that happened in the 80s. And following the start of a drought monitoring center in Harare, one was also developed in Nairobi. So these are our member countries. We serve 11 countries, where 8 of them are IGAD member states and 3 are East Africa member states. In terms of our services, we provide services in terms of climate monitoring and forecasting. So we do monitoring from 10-day to seasonal. Then we also do forecasting from 7 days. We also do short range forecast, including days to hours, but basically on systems that have short lifespans. We also provide information on climate change, and all this climate information feed to different sectors that are affected by climate, including agriculture and food security. We support water resources, environmental monitoring. We provide information for disaster risk management in the region. We do a lot of capacity building, especially across all these areas of service, and also support information, climate information communication and co-production. So in terms of the climate information that we provide to the public, we provide seamless climate information ranging from few hours to daily, and basically focusing on systems such as the tropical cyclones. We understand that these are some of the systems that affect patterns of weather in our region, especially when we talk about onsets, cessation, and even the distribution of rainfall during the season. We also provide weekly forecast, monthly, seasonal, and climate change information. That is information that is relevant for different planning purposes for different users that we provide for. Although we are a regional climate center, we work with national Met services, we work with governments and ensure that the practices or the good practices that are done at a regional level are cascaded all the way to community level. So we partner with national governments to work with communities on how to interpret climate information, and even how to apply climate information, especially when we have upcoming seasons. So we organize climate outlook forums at regional level, where we invite regional and national actors and provide climate information for an upcoming season, help them on how to understand this or to interpret this climate information, and even support them on generating expected impacts as a result of the climate situation prevailing and even expected, and also come up with mitigation strategies to avoid losses. So we interact with our users, and we have different ways of disseminating information. We have user interface platforms, including the Greater Horn of Africa Outlook Forum. We also have online platforms that people can interact with and get a lot of climate information that we disseminate. And also we have social media platforms. We have our website that you can always access and get the climate information that we provide. You can also subscribe to our mailing list, and you'll be able to get all climate information as and when we release. So to the big problem that we have all faced, we've had challenges in understanding what El Nino is, whether El Nino is there or not, especially if you're coming from East Africa, and specifically in Kenya, you know what has been happening in the recent past. So I know most of us still get challenges on understanding what El Nino really is. So this is just a schematic diagram showing us what El Nino is. So when we talk of El Nino, we do not talk about rainfall. El Nino is not equal to rainfall. So El Nino is basically about sea surface temperatures warming and cooling, especially when we talk about El Nino, we are talking about Pacific Ocean. If you are able to look at this schematic diagram, the area with a red circle on the right, this is Pacific Ocean. We would basically have the eastern part of the ocean and the western part. So when we say there is a prevailing El Nino event or a El Nino condition, we'd be talking about the surface temperatures over this eastern part being warmer than usual, much, much warmer than usual. And what happens when it's warmer than usual is that the rate of evaporation, in simple terms, increases, and therefore we get too much rainfall over here. And because we know that the globe is connected both by oceans and atmosphere, There's a very close relationship between what happens over the eastern part of Pacific and Eastern Africa region that is on the left-hand side. When we have this warming over here, it corresponds to more evaporation over the Eastern Africa region that increases the rainfall. Basically, a normal situation, we would have the same, almost the same pattern, except that this would be only one pattern that have an arrow showing rising motions. But when we have this extreme warming here now, what happens is that extreme rainfall happens over Eastern Africa. And the opposite happens when we have cooling over this part of the Pacific Ocean. Basically, El Nino is associated with increased rainfall over our region because of the increased warming here. And the opposite happens when we have cooling here, we have what we call La Nina. So having understood that, we want to see how specifically does it affect our region. We want to understand first that the impact of El Nino is not the same every year. It varies from one year to another. At one point, you might find El Nino causing extreme rainfall. In another year, despite having a strong El Nino, the amount of rainfall you get is not as much. So we understand that although El Nino is always or almost usually associated with enhanced rainfall, it's not all the time. And it also has different impacts in different parts. If you go to the southern part of the region during the November to March season, El Nino conditions would basically be resulting to depressed rainfall. And then over the northern part of Eastern Africa, El Nino would be causing depressed rainfall also during the July to September season. So you realize that the impact of El Nino is different in different parts of the globe, basically, and during different times of the season. Research has shown that climate change is expected to cause increased frequency and intensity of El Nino events. And we realize that as these frequencies and intensities change, we also expect the same impact on the amount of rainfall that we are getting, even including extreme events that happen within the season. So what we normally fail to understand is that apart from El Nino that happens in the Pacific Ocean, there is also another condition that happens, a phenomena that happens in the Indian Ocean, because we understand that the oceans are connected. So basically, when something happens in the Pacific, you would most of the time experience another phenomena happening in the Indian Ocean. So we also have what we call Indian Ocean dipole. Most people call it Indian Nino. And it's the same principle really with the El Nino, where at some point we have the sea surface temperatures close to the Eastern Africa region, the coastal part, being warmer than that over the eastern part of the Indian Ocean. So when this happens, where the western part is warmer than the eastern, we have what we call positive Indian Ocean dipole. And when this positive Indian Ocean dipole happens, it results in enhanced rainfall because we realize that more evaporation happens and therefore more intense rainfall or excess rainfall is experienced during the October to December season. This is basically one of the systems that influence only the October to December season over Eastern Africa. So El Nino and Indian Ocean dipole are related. They when El Nino happens, most of the time, a positive Indian Ocean develops, but not always. There are cases that we've had El Nino developing in Pacific Ocean, but there is no anomalous warming or cooling in Indian Ocean. And there are also cases, in fact, most of the time, you will get Indian Ocean dipole being positive with no El Nino or La Nina. So these are the dynamics that happen in the ocean, and they cause extreme rainfall or enhanced rainfall in Eastern Africa, especially during the October to December season. So these are just case studies or samples of years that we've had El Nino happening, with either Indian Ocean dipole being positive or being neutral. And one of them is 1997. I think this is what everyone knows. When the October to December 2023 forecast was released, many people knew that the season was going to be as wet as 1997. And when the season delayed, people were already like, the Met services did not give us the right information on what we expect and all that. So this is what happened. In 1997, we had El Nino and positive Indian Ocean dipole, and we can clearly see that there was enhanced rainfall over much of the region. This is the central part of the region. This is Uganda, Tanzania, and you can see that most or much of the rainfall was recorded over Kenya. And then in 2015, we had a Nino and a neutral Indian Ocean dipole. So you can see that there are other cases where the Indian Ocean dipole remains neutral, but there is already an ongoing El Nino. We also remember that 2015 was one of the strongest El Ninos. But if you look at the amount of rainfall that we got in 2015, is much, much less than what we got in 1997, despite having the El Nino being positive. And the reason is because the Indian Ocean dipole did not respond, and therefore the only impact was felt. The impact in terms of how much rainfall was recorded was because of the El Nino. Then in 2019, we only had a positive Indian Ocean dipole, and we can see that if we compare the El Nino and the Indian Ocean dipole only using these 2 years, we realize that the Indian Ocean dipole is associated with more enhanced rainfall than what is caused by only El Nino. So we realize that the Indian Ocean plays more role in determining how much rainfall we get in the region when compared to the Pacific Ocean. So coming from a region that has faced with rampant miscommunication of climate information, so sometimes we find ourselves communicating information but do not realize how much impact we are causing, both to individuals, to organizations, and to even our economy. So one of the problems that arise when we give out inaccurate information is that many people, many communities are likely to be less prepared because they make decisions on using false information or inaccurate information. So false or miscommunication of climate information hampers decision-making, both at individual and community level, that basically prevents them from being prepared when we have extreme events. It also leads to economic losses. We realize that given that many users rely on this climate information, and most of them would basically make decisions using this climate information, any changes that are made on regular plans, changes and any decisions made on this information will really change a lot in terms of practices that people do. If you take an example of farmers, for example, if you issue an information that we do not expect much rainfall this season, when that information is not really accurate, you realize that people will end up growing and suitable excess rainfall or enhanced rainfall. Those crops are not likely to produce enough, and therefore people lose a lot in terms of finances and even the economy, if that is a bread basket of that region that use that misinformation. Then misinformation also is one of the brings problems to authorities, especially those who are responsible for disaster response. Using inaccurate information for disaster response would basically render millions of people to situations of safety issues. And we've seen this in the recent past in several parts where people responsible for disaster response were not ready, and people really lost lives and even livelihoods because of misinformation. Then another thing that happens when we pass this false information or inaccurate information is that people tend to lose trust on climate information producers. Many people do not verify the source of the climate information that you give out. So they would trust that you get this information from the climate information providers. So once they get this information to be inaccurate, they've made decisions that have rendered them to experience losses, they'll tend to lose that trust. And the next time they are given climate information by the mandated institutions, they will not be able to trust that. How do we come out of this misinformation? Sorry, my screen just, okay, yeah. So it's the responsibility for all of us, whether you're a journalist, whether you're a user, whether you are a climate information provider, it's a responsibility that we should all work towards combating this dissemination of false information. So as a journalist, for example, we should avoid the rush for news. I know what journalists rush for. You want to get the news. And an analogy that we've always had is that when a dog bites a man, it is not news. But when a man bites a dog, it's news. Let us not rush to give information that we are not very sure because we want to be the first one to disseminate this information. It doesn't help. So let us avoid rush for news. And also, let's all promote media literacy. As a regional climate center, we provide training to journalists through what we call the network of climate journalists of Greater Horn of Africa. So if you're interested in learning more about how to interpret climate information and all that, you can reach to us and we'll be able to provide this climate information. We also provide this climate literacy to journalists through the Climate Outlook Forum. And if you'd want to plug in, we are having one next month and you can reach out to us so that we can have you invited. So we should also use reliable sources and mandated institutions. Most of the information that is spread is basically from unmandated institutions who are just running propaganda. And therefore, if we get this information from institutions who are not liable, we end up sending out inaccurate information. And therefore, it's our role really to ensure that the source that we are getting this information is really reliable and they are mandated to provide that. And basically at national level, we have the National Met Services, and those are the institutions that would be reliable to give you the accurate climate information. Fact-checking and responsible information dissemination will be something that we all want to do.
Yep.
So in summary, we have talked about El Nino. El Nino can cause extreme rainfall when it occurs, while on Indian Ocean responds with a positive dipole, and therefore there is this very close relationship with both what happens in the Pacific and the Indian Ocean. So having to understand what really happens tells us how much effect we expect in terms of how much rainfall we are going to expect. And basically, let's look at how we communicate the climate information, because it really brings down so much in terms of economies, it brings so much losses, and people end up losing lives and livelihoods. Thank you so much. That's all I have for today.
Thank you very much, Eunice. And ladies and gentlemen, remember, we will have a Q&A session. And if you have any question currently, just post it in the Q&A. Then I will direct all the questions to the panelists. So I encourage you to continue putting those questions. I've seen a couple of questions, and we had a few that were sent when folks were registering. But I encourage you to just put them when they come, and we will direct them to the panelists during the Q&A session. So next, we move on to our next speaker, Dr. Solomon. If Eunice can stop sharing.
Thank you very much.
Eunice, if you can stop sharing, thank you very much. Thank you, Doctor. The floor is yours.
Let me share my slides. I hope you can see my slides.
Yes, we can.
Okay. Okay, thank you very much. I will try to be as brief as possible. Some of the issues have already been addressed by Eunice. My task will be mainly to focus on the health impacts of climate change and El Nino. So, as you know, climate change, it presents a fundamental threat to health, to human health. And unfortunately, as you know, even if African countries are contributing less than 4% of the global carbon dioxide emission, we are the one bearing actually the burden. And WHO has declared the climate change to be the biggest health threat of the 21st century. So just to mention some of the impacts or the consequences from climate change. As you know, it affects the physical environment as well as aspects of both natural and human system. So directly contributing to humanitarian emergencies from heat waves, wildfires, floods, tropical storms, and hurricanes. And globally, 3.6 billion people are living in areas highly susceptible to climate change. And between 2030 and 2050, climate change is expected to cause approximately 250,000 additional deaths per year from undernutrition, especially in Africa region, from malaria, again, our region is the most affected, diarrhea, and heat stress alone. So this is really substantial, and we have really to be worried, and that's why WHO has declared it to be the biggest health threat of the 21st century. And the cost is also huge. And it's estimated to be between US 2 to 4 billion per year by 2030. So, in addition to what I have said, it also affects the workforce. The health workers are also part of the community and the infrastructure as well. So it will reduce the capacity to provide health services. These are some of the direct consequences. And from the indirect consequences, it is creating a lot of stress as well. The floods and rising sea levels degrade the environmental and social determinants of physical and mental health. And, you know, the issue of mental health has significant implication, for example, on the way, not only how we cope with disease, but also how we interact with within the community, in our social interaction as well. So indirectly, it is also eroding the social fabrics and also contributing for the deterioration of health of the community. And from the food insecurity, which is significant in our case, due to drought, of course, malnutrition is eminent, especially in countries in Africa where the community do not have reserves to cope, do not have the resilience to at least stand the season of a drought. Scarce water most of the time leads to inadequate access to safe water, and excess water is leading to flooding and also creating favorable ground for vectors, so that there will be more vector-borne diseases as well. And the infrastructure damage will affect access to health services as well. So it is paramount, actually. So if you look at, maybe in summary, if we look at the climate-related hazards on the left and the consequences or the health impacts on the right, it is obvious that the extreme weather events like El Nino, the heat, the sea level rise, the air pollution, the vector distribution and ecology, water scarcity, and reduced food production will have impacts on the health. There will be injury and mortality from extreme weather events, heat-related illness, respiratory illnesses, waterborne and water-related health impacts, zoonotic diseases. So these are diseases that are transmitted from animals to human beings, the vector-borne like malaria, malnutrition and foodborne diseases, non-communicable diseases because of the stress, mental and psychosocial illnesses as well. So obviously the impact, as I have mentioned earlier as well, it is substantial, and the health sector is one of the sectors which is seriously affected by this weather event. When we look at El Nino, the El Nino Southern Oscillation is one of the important events on climate variability. They are associated with characteristic patterns of rainfall and temperature, as has been mentioned earlier, and it has severe effects on key determinants of health and other social factors as well. For example, it can affect food security, which I have mentioned already, air and water quality, ecosystem and health infrastructure, and the safety, social safety as well. It is also associated with altered transmission pattern of vector-borne and rodent-borne and waterborne diseases as well, including fish and shellfish poisoning as well. And I think this has been mentioned, the strongest El Nino events. I'm going to, and I think the graph there as well shows some of the events that are associated with some of the El Nino years. Even though there is no any conclusive evidence of the impact of climate change on the frequency or intensity of El Nino or La Nina, the climate change affects the impacts related with El Nino and La Nina terms of in terms of the intensity and frequency of extreme weather and climate events. So, unfortunately, the most affected, most vulnerable are areas with weaker infrastructure, with weaker system. And if we have to cope with this one, we have to address strengthen the health system as well, and reducing emissions of greenhouse gases through the various means that has been mentioned will have paramount importance, especially for the health sector. One important thing that we have to stress, and maybe an important message for you to take and maybe pass to your viewers, to your listeners, is that the events can be predicted, as has been mentioned by the previous presenter. So if it can be predicted in advance, then there is this possibility of doing some coping measures, some preventive or coping or at least mitigating measures as well. For example, improving on the crop yield, so that if El Nino is coming, and we know some of the areas which are affected by drought, we know the areas which are affected by flood, so appropriate measures has to be instituted. For example, in the past, IFRC at some point have done a very good job by just identifying the high risk areas and supporting the governments to do some protective measures. In 2014 and 2015 as well, the information that was released by International Research Institute for Climate and Society was used in East African communities to do some interventions to reduce malaria transmission. So I think the message is that we have to do this. We have to listen to those who are doing the forecast, and we have to take those information and translate it into action by governments, by the community, by humanitarian actors as well. So there is a possibility of really mitigating or reducing the impact that I have already shared with you that is expected to happen in the coming years. So in some of the diseases or outbreaks, there is already strong evidence. For example, the association between El Nino and the malaria has been documented in many studies in Southern Africa, South Asia, and South America as well. There are evidences that because of El Nino and the rainfall and the temperature patterns, it creates a favorable ground, as I have mentioned earlier, for the vectors and for the mosquitoes breeding sites and also for the causal agents as well. For Rift Valley fever, for example, since 1950, each of the 7 documented moderate or large Rift Valley fever outbreaks in the Horn of Africa have been associated with ENSO because of the abnormal rainfall and because of the favorable ground for the vectors. Even though there is weak evidence, especially for association of dengue, still, dengue is also transmitted by mosquitoes. So maybe this is a call, again, for doing more research and for documenting some of those evidences. For example, in Bangladesh, studies have identified effects of increasing sea surface temperature influenced by El Nino to amplify marine reservoirs for the cholera pathogen. And for your information, the major cholera outbreaks in Tanzania and other parts of East Africa, especially in Uganda, they have documented that they are associated with the strong El Nino years of 1997 and 2015. And of course, we remember the El Nino-related drought of 1997, which has contributed to the exacerbation of wildfires in Brazil, Indonesia, and Malaysia, and the drought in Southern Africa in 1991-1992, affecting nearly 100 million people. The World Food Crisis of 1982-84, the most severe recorded, was also linked with El Nino, including famine that struck population in the Horn of Africa and the Sahel. Again, drought in Brazil, Northeast China, Indonesia, Marshall Islands, Papua New Guinea, and the Philippines have also been associated with ENSO. So the flood risk is obvious. You just remember what happened in the last few months, the El Nino that has caused serious floods in Somalia, Kenya, and the southeastern part of Ethiopia as well. So I think the evidence is already documented. We did a sort of a risk assessment, a rapid risk assessment for the El Nino in the greater Horn of Africa. And these are the areas that we have identified, and we have been working with the member states as well to strengthen their preparedness. Some countries have done well, like Kenya, for example. They have been prepositioning some of the key supplies, and hopefully it might have contributed for the response that they have been doing during the aftermath of the floods, following the serious floods that they have encountered in the last few months. So malnutrition, it was certain, of course. Cholera, and as you know, especially even the El Nino that we have, even though some areas are affected by dry season, by floods or weights, some parts are affected by dry season. So it is both. So the issue of malnutrition was certain. Cholera and other diarrheal diseases was almost certain. Malaria was almost certain. And in many areas, we have seen that we are still struggling with cholera. In some places, it was controlled and it's picking up again. For example, Tanzania, almost it was controlled, but now it is peaking again. And the surge, the country is dealing with the surge of cholera cases. Malaria is likely to continue to be a major concern for the coming months as well. Rift Valley fever is also highly likely. We have some reports from some of the countries recently as well, and other vector-borne diseases because of the breeding sites like dengue, like chikungunya, are a possibility as well. So measles, because of the population movement, the indirect consequences, the displacement, and of course, disruption of the health services, measles is also highly likely, and the conflicts that we have in our region as well. And other vector-borne diseases can also be considered as at increased risk. And of course, the effects of heat, stress, and air pollution, maternal and child health as well, because of the decreased access to health services. Whenever there is flooding, of course, mothers and children are affected, direct injuries, and gender-based violence is also a possibility, mental health and psychosocial support as well. So the advice that we have been providing to the countries was to assess and monitor how El Nino can alter health risks, develop strategies and active emergency preparedness and response measures. Most countries have developed contingency and preparedness plans. And of course, there has to be an effective coordination and communication strategies. And here, you really play a very important role by providing the information and by fighting misinformation as well. So I think, in summary, with the climate change, we are observing frequent drought and cyclones. And this is leading to more disasters and displacements. And we are noting rising disease outbreaks, cholera, malaria, and others. And the population movement as well. It's really affecting or providing for the complexity of the emergencies that we are dealing with. And the conflict, unfortunately, in our sub-region, in our region, is affecting, is putting more fire into the existing disasters and the vehicle system as well. So these are some of the health impacts, the direct and indirect, which I have mentioned already. But I think the map here is also interesting. You can see increasing storms and cyclones in Africa from 1971 to 2011-20 as well. So you have seen, especially last year, how many cyclones we have been addressing, especially in the southeastern Africa. So with the increase, with the climate change, we are really noticing an increasing trend of storms and cyclones. So I think as we need really to continue advocating for implementation of these commitments from COP28, especially on the health sector. There are several commitments that have been entered. If implemented, can really bring a significant change for the health sector. But I think we have really to do our part as well in advocating for and in following its implementation. Some of these are some of the commitments: strengthening the development and implementation of policies that maximize the health gains from mitigation and adaptation actions. We know that countries are developing action plans to mitigate and adapt to the climate change. And there are some commitments to increase the resource allocation as well. But if we do not advocate for, because the health is one of the sectors seriously affected, if the health issue is not addressed, and then maybe we'll continue facing similar, the health consequences might continue, or we might not be able to mitigate some of the impacts from the climate related hazards. And the issue of One Health is really very important. The next point also is similar to this one, addressing environmental determinants of health and intensifying efforts for the early detection of zoonotic spillovers. Most of the outbreaks, if you look at that has happened in our country, like the most serious ones, like Ebola, Marburg, Rift Valley fever, they start from animals. if there is a very good One Health approach between human and animal health, there is a possibility of detecting the outbreak while it is in animals before it is transmitted into human. So that is something that has been highlighted and is something that we should also continue advocating for. And also, I think sometimes we forgot the significance of healthy population. A healthy population is important for everything, for what we plan, for what we implement, and for what we do, even in the climate resilience. So it's something that is recognized, but it's something that we really have to advocate for its implementation. And of course, improving the ability of our systems to anticipate and implement adaptation interventions. This is also very key. We have mentioned earlier, sometimes it's possible to predict, but predicting only is not enough. We have to take appropriate measures to prevent that well. Promoting a comprehensive response to address the impacts of climate change on health, the issue of mental health, traditional medical knowledge, loss of livelihoods and culture and climate-induced displacements and migration as well. The issue of inequality is important. And of course, the issue of emissions, one of the important decisions that has been made during this meeting. And this research that I have mentioned earlier as well. There are a lot of gaps still. And we need really to beef up the research and the cross-sectoral collaboration and sharing the best practices and monitoring progress as the climate health nexus. This is what I have, and thank you very much.
Thank you very much, Dr. Solomon. And in the interest of time, we'd like to jump straight into our next speaker, Mr. Urasa, Alois Urasa.
Yes, thank you. Thank you very much. Can you see my presentation?
Yes, we can.
Okay. Thank you. Thank you very much. It is really my great pleasure joining you this particular day to present on preparedness issues on climate change and health, and particularly on the explained issue that is really pressing at the moment, the effects of El Nino and public health. And I would like to talk much about the science, as Eunice has really explained it very well, about the science behind El Nino, what it means about El Nino and La Nina, and the differences, and how the interrelation between El Nino and Indian Ocean, the IODs. And here, my name is Alois Urasa, as introduced. I'm a public health scientist and currently working on a research study that we are looking at the preparedness state of the countries in responding to the effects of climate change and health in health systems. The main question is, we are discussing and we are seeing the impacts, but are we really prepared? And when you ask this question, it will be answered differently. How a journalist will answer a question about preparedness state of a country or a community might differ from how a community member, a lay member in the community will respond. And it might also differ from how an expert in the field will explain. It will differ from how a scientist, a public health specialist, or a government member or a government leader will respond to this question. But when we look at the global level, there are already defined steps or approaches in responding to the issues of climate change. And since 2015, we have the Sustainable Development Goals, where one of the goals is very specific on issues to deal with climate change. But the goals are interconnected. Being one of the characteristics of these goals is that they are interconnected to each other, and therefore having SDG number 3 talking about good health and well-being, and SDG number 13 talking of climate change, and interconnecting these goals, we find that if we ask someone with a global perspective, we'll tell you by having sustainable development goals, perhaps it means that we are prepared to respond to these threats on health due to climate change. But I wouldn't want to go back again to what Dr. Solomon has already explained about the effects that we have of climate change and why it is important to talk about climate change and health, given all those potential threats and risks that are posed to the health, having all these extreme weather events that are not only destroying the infrastructures, but also destroying health facilities and the infrastructures to access these health facilities. And this affects the entire health system, where one of the components of the building block of the health system is the infrastructure itself, but also it's about service delivery. So when the infrastructures are blocked and access is inhibited for people to access these services, it is evident that there is either no or poor delivery of these services. There is also the issue with inequity. So those who are in areas with more stable or resilient infrastructures will have more access to health facilities, or will have more access to healthcare services than those who are in areas that are prone to destruction due to the impact of climate change. But going forward, the global temperatures are rising, and we see the difficulties we have with El Nino, and even the predictions that were made. Eunice mentioned earlier about the challenge that the community is facing. They are really in a conundrum of as to who they should listen to, because they expected, or the community expects, that the experts' opinion is the final opinion that they should go with. And it was communicated, for instance, that from October to December, that's when El Nino is really going to come up with some potential effects that were, as it was announced to the people in most of the East African region. But the thing has really been different, because El Nino is still there, and that it has been delayed, and perhaps it's going to be delayed until maybe March, when it's already going to meet the normal rainfall season. And so we are going to be throughout a long period of rainfalls, which is rainfalls are good, for instance, for agriculture, but they're also not good when they come in unpredictable moments, but also when it is extreme, it's already not really good. Dr. Solomon has given examples, like in Tanzania currently, there are almost 15 or more regions have reported having cholera cases. And we are even anticipating more cases coming up. For instance, recently in the Lake Zone, they've mentioned a lot of new cases. I'm sorry, I don't have the data to give you right now, but there are a lot of cases that have been reported recently. And we are even seeing more other cases coming up, more other diseases coming up, water-related diseases, vector-borne diseases, rising up in very unanticipated numbers, but also the burden shifting to those places where we expected that we are almost heading to elimination phases, for instance, of malaria. We are now starting to receive heavy cases from these areas. But the question is, are we prepared to respond to these potential threats that we are already seeing? So globally, there's a framework that was set up by CDC, the Center for Disease Control, that is on how to approach or to build climate resilient systems. And this is a 5-step that I wouldn't want to take you through details, but just to highlight it, that this is a framework that will help on how to, with the issues of forecasting, projecting the disease burden, assessing the public health interventions, developing and implementing adaptation plans for climate and health adaptation plans, but also evaluating the impact. But the most important thing is now to think as a system. As a journalist, even when you are communicating or when you're writing a piece of article about, maybe you've done an interview or you are just writing your opinions as an expert, it's important to look at the entire system and to connect ideas on how the solutions that you're proposing, or the kind of solutions that you're calling for, or the call to action, really touches on the response to a systemic response. And we look at all the 6 building blocks for health system, for stronger health systems, because all these blocks are affected in one way or the other by the impact of climate change. And due to the amount of time now, I just go through directly to what journalists now should and can do, and even should be doing at the moment. When you're communicating, it's very important to do thorough research. Don't just write an article or a news before you have researched to clarify the points that you are giving out, and talk to experts. The experts are open to sharing the points to ensure that the news that is going out to the community is really clarified, because sometimes there's a lot of conflicting information that is going out there. You'll find this one media has reported this kind of information, and another media comes with contrasting information. This is very unhealthy for the community, and this even brings us back to very fragmented approaches, and even affects how we are responding to the threats of climate change to our health systems. But communicate to help the community and not for fame. And this is also a matter of integrity, just to link the points. A good journalist is a journalist who really cares about the impact that the news they're giving out is going to impact the community. When you tell for instance, when you just put a headline that El Nino is going to cause this much rainfall in this area, and you haven't clarified the information, you can imagine the level of frustration that you are giving to the people in that particular area. So it's even affecting the mental health of these people, their stability. On that day, but people have seen that news. Definitely some students will not even go to school because they are worried about the kind of information I've communicated to them. Some people will not go to work. So you are not only affecting their psychology, but also the economic and social perspectives, but also education systems. You're just disrupting everything. That's how bad just a single news can be. But also avoid bias. Sometimes you might have read a book, you might have read from a scientific paper. You always gain your perspectives and your understanding from that paper. Before you communicate it, try to gather perspectives from different communities and stakeholders. And just to wind up with the amount of time, is that the role of journalists when it comes to health system strengthening is really crucial. It's really crucial. Communicating about climate change recently has been like, it is like everyone wants to communicate about it, but don't just be like everyone. Make sure you become a really distinguished journalist, an impactful journalist, and well-informed journalists that really want to bring an impact to the community. Make sure you go through, you are well-informed, and that information gives you sufficient knowledge, and you really understand, and you have enough wisdom to communicate that information before you give it out. From there, I'd like to pause and again leave this question to you. Are we prepared? And what does preparedness mean in your perspectives? And that is still my research question, but I cannot answer it completely now until I've finished and I've gone through different responses from different people. Thank you very much.
Thank you very much, Lois, and all the best in your research. And we now move to our final speaker. And before you begin, Adele, I'd like to already give you a question because you're dealing with journalists. And we have a couple of questions. One, maybe I'd like you to touch a bit on media literacy. I've seen a few folks here are interested in like Jean is interested in media literacy and fact-checking. And then there's Catherine from Zimbabwe, who shared here that they were told there's going to be minimal rains to drought. But since Christmas, Zimbabwe has had excess rains, even some flooding. And farming, which is a major venture there, have been affected because folks had not prepared seeds, chemicals, etc. So they are confused. How do they report this kind of information where there's contrasting information? Maybe they don't have units.
Yes. Okay. So that's a great segue into what I want to talk about, which is very much, sort of how we need to cover the story. How do we tell the story? And interestingly enough, on the last query, Eunice has come to the fore and has answered that question beautifully. So it's certainly not a question that I could answer, but the expert has, which gives us straight into the answer that we need. Where do we get the answers? We need to have really good, strong sources, okay? And what Eunice suggested in that reply, if all of you go to the chat and have a look, is that this is complicated. This is complex, okay? So it's about knowing the science of El Nino, El Nina. Somebody asked, what is the difference between El Nino and El Nina, for example? And in addition to that, the answer that Eunice gave was really comprehensive in that what she was saying is that things change, and that while she addressed certain issues around El Nino, there are other factors. So, you know, the person to go to in instances like this, and I think it was Catherine that posed that question, is actually to get Eunice, somebody like Eunice, who's clearly very, very good at explaining information and has a passion for it. So it's a win-win. And those are the kinds of people that we as journalists need to get hold of. I find the climate science quite difficult. Do you remember the time of COVID-19 and the vaccines? We all had to come to grips with COVID-19. We have to do exactly the same thing now. So, for example, you need to familiarize yourself with the science behind El Nino and El Nina. You learn how it influences ocean temperatures and atmospheric conditions, for example, and which causes the severe droughts and floods that we're having. Another point that I just wanted to raise is that we need to understand that El Nino, okay, and El Nina is actually a natural phenomenon. This is something that's been occurring for 25 years or so. So then what is the connection to climate change, you may ask? And it was definitely hinted at by our previous speakers. And that is that because it increases temperatures, okay, that adds to the general global warming with climate change together, it makes things worse. So climate change has an impact, and so does El Nino have an impact. But in essence, El Nino is actually a naturally occurring phenomenon. And I urge you, those of you that haven't actually really gone into the science of it, it's actually quite simple if you start doing some, getting some information and start researching. You have to do the research yourself. You have to read and you have to understand what you are talking about in your stories. So that's just one of the things. The other thing that's really important is to understand the science of climate change. Do all of you know exactly what the greenhouse effect is, for example, how the world is heating up? Do you understand that the climate change is basically, according to scientists, that it is human-induced? It's because of what we are doing. We are burning fossil fuels. So it's increasing the temperatures, okay? So then we've already got stories about how we can change that. You know, how do you stop that? And that's the whole issue around renewable energy. And there are just so many stories in this particular area that we can follow. You know, do you understand the key terms? What does mitigation mean? What does adaptation mean? What is an extreme weather event? Okay. What is renewable energy for that matter? Many of you will know that, and some of you won't. Those that don't, now is the time to learn. So the other equally important thing to understand is the science of health. So, you know, with a great input from all three of our speakers, they have been referring to health. What are the health impacts? Okay. Are these issues actually related to climate change and to El Nino or not? Or have they been made worse? Those are the kinds of questions you need to actually ask. And those are the kinds of issues you need to address in your stories. Eunice said, stay updated. That's exactly what my tip would be to you. Keep on top of the latest developments, right? On the policy involved in climate change, for example. How is your government dealing with the issue around El Nino, okay, and the increased rainfall and so on? Is the country prepared? These are questions, straight, ordinary, who, what, why, when, etc. Okay, fact checking. Well, you can fact check once you have the correct sources. So, you know, if it was me, I mean, I just feel like I right now would like to interview Eunice. I would like to interview Dr. Solomon, and I would certainly like to interview Alois. Because they have a huge amount of information, and there are things that I feel like I don't know that I would want to engage with them on. So with fact-checking, you've got to cross-reference data, you've got to understand the data, you go to Eunice, you say, look, this is what's come from me, could you please help me understand this? And this is a person who's clearly going to be available. So the other thing that I feel is really important is that issues are interconnected. And this is what we need to do, is we need to reflect on the fact that the health impacts on climate change and the El Nino phenomenon are interconnected with other global challenges. So what are these that I'm talking about? It's social justice, inequality and lack of access to healthcare, right? And you really need to explore those things in your reporting. So what climate change is just making things a lot worse. The other thing, in terms of if there's no access to health or there's inequality, I'm just moving fast because we've only got 15 minutes left and I want to make one or two more points. The other thing is, of course, the human stories. And I know that there was a COP. There have been some COP fellows that are in the audience. Please, I would love you to add your voice to these discussions about how to run these stories. And I have read one or two of your stories, and some of you have written the most beautiful stuff around incorporating community and telling the story about, sort of climate change and the health impacts through the voices of community. So we do need diverse voices. We need to hear from different perspectives, okay? That's really essential. But also you've got to be careful, and it was the same during COVID. You've got to be careful because you've got to avoid false balance. So you can't give a huge amount of information or time to people that are climate change denialists, just like we had the anti-vaxxers, okay? So in addition to that, we've got the climate change denialists. And finally, what I'd like to say is that you should also show success stories. Our communities have been beaten down by poverty, by failing health systems, by climate change and its impacts and so on. So tell the good stories, the novel approaches, okay, that are aimed at mitigating or adapting to climate. How people can do things to be prepared. If it means digging a trench, find out. How can they ward off really terrible incidents? Maybe they need to dig a trench. I don't know. That is something that needs to be written about. And of course, you need to track policy and legislation. It's very important. What is the government doing? Follow the money. What is the government doing? So with that, I'm going to tell or suggest that we are going to be giving you a guidance, some of the points that I've made. We're going to, it's tips on how to tell the story. So that we'll share towards the end of the dialogue. But at this point, I'd love to ask journalists that are out there, what are the challenges perhaps that you are experiencing so that we can sort of workshop it just for the amount of time that we have left? Anybody who would like to start with that question, or anybody who has another kind of question that they would like to put to any one of the speakers? Thank you. Thanks for the attention.
So before we go to any other question that has come up, I want to put Eunice on the spot. Eunice, I've seen you've, thank you for answering these questions which have been sent by our participants. Maybe you can voice some of them for us.
Yeah, thank you so much, Tole. Very nice questions really from participants. And for the source of information I've indicated where we get more of how El Nino or La Nina affects rainfall of our region. And it's a whole system really that you can get other information. So if people can go to the IRI map rooms is a very user-friendly source of information for non-climate scientists. You will be able to get a lot of information really. So, and then the last one, of course, Adela has talked about, we need to continuously follow up with Met services because things change even in the middle of the season. And one thing we should first focus on is once a forecast is issued out, which I know most regional centers or Met services issue, is that they issue a forecast that is in probabilistic format. The problem that we've had as users is to imagine this is a deterministic forecast. What I mean is a forecast is telling you that there's a high chance that the rainfall will be depressed, but there are also chances that the rainfall will be enhanced. So proper planning, especially for users like farmers, should ensure that there's there's resource allocation to the different scenarios that are likely to happen. Because having a 45% chance for above normal, 35 for normal, and the rest for below, tells you that there are very close chances that it can either go above or normal. So we have what you call participatory scenario planning. Can we plan according to what climate information we are given and not assuming that the climate information that we are being given is determinate? one thing we need to understand is that we're using climate models. Climate models are never perfect. And therefore, we have a space for uncertainties. And if we had another opportunity, we could explain the sources of why their forecasts are never perfect. That's why they are called forecasts in the first place. They are never 100% perfect. So we should understand how to plan with climate information that we are being issued and ensure that, like Adela said, and I also pointed out, we should always be up to date. Follow on the monthly forecast, follow on the weekly, even the one-day rolling. It's very important to keep updated because there are practices within the season that you can change. You can supplement for irrigation, you can do mulching, you can stop weeding, you can convert your maize to forage. I mean, there's so much that we can do if we continuously follow this climate information. Thank you.
Thank you very much, Eunice, for that. Adele? So if I have a couple of questions which were sent earlier, and in regards to preparedness, and Mika says there have been a lot of task forces and organizations and regions which prepared for the El Nino that was supposed to come, but we are still seeing flooding and all the disasters that come with it. So what happens to the strategies that these groups come up with is a question from Mika from Kenya. We also have a question on vulnerable populations where they're asking, in what ways do vulnerable populations such as children, the elderly, and those with pre-existing health conditions face heightened risks of El Nino-induced climate events in the region? And then there's a one on modeling. I think you've just answered that. But there's also one on early warning systems. How effective are the current meteorological early warning systems in predicting El Nino-related climate events? And what can these warnings be translated into with regards to actionable health advisories? If we answer that, then I have two more to the panel.
That's very, very, very intense questions, really, and I'll take the last one. I didn't really get the one from Kenya, but I'll answer the last one.
Oh, the one from Kenya is that there have been lots of meetings and everything that's going on, but they're not seeing anything tangible. Like, what was implemented from that? Was it really implemented, or it's just meetings? And so after you, I think Dr. Solomon will pick up that. Thank you.
So I think that is beyond my desk. Mine is to provide climate information. Policies and what happens goes beyond my desk. So on the question on our early warning information, how accurate or how reliable they are, especially when we're talking of forecasting El Nino. El Nino develops way earlier, and it's very easy, or its forecast is a bit reliable, or I can say it's very reliable, but the impact that El Nino event causes is what is not very reliable. But forecasting El Nino is really quite reliable as early as April or May, because by June, it's expected to develop and even impact the rainfall over the northern part of the region from June to September. So forecasting El Nino is quite reliable, but the degree of impact that it causes on rainfall is what still becomes a challenge in a few cases. Thank you.
Thank you, Eunice. Dr. Solomon, the floor is yours.
Thank you. Thank you very much. Very good questions. Let me start from the second one about the vulnerable population. What can be done? We have a vulnerable population like elderly, children, a number of others as well. Yes, I think we have not yet reached there. As the previous speaker during his presentation said, are we prepared? No, we are not. That's why, I mean, our ministers, our head of states, all other partners have been discussing on this one, especially what can be done on this climate adaptation and mitigation. So we are not yet there, but what should have been done is what we call this vulnerability risk assessment and mapping. As we know, we have to do those mapping. As unfortunately, in most countries in Africa, because of a number of reasons, some of the vulnerable population are living in areas which expose them to some of these risks, the flood, for example. So they are living in river bands, very close, without any protection. So countries have to do that mapping. What are really, in the first place, we know the hazards. And those hazards, it can be flooding, it can be the El Nino, as Adele has already mentioned. Those things will continue coming. They will happen. We cannot stop them from happening. But what we should do is trying to predict when those hazards are going to happen. And then if they happen, who is going to affect it and where? Then once we identify that one, we have to take preventive measures because we cannot stop them from the hazard from happening. Unfortunately, in most countries, that type of thorough study and analysis is not done. So you have to do the vulnerability risk assessment and mapping, and then after that one, you have to take action. In some extent, what is being done now, maybe I'll come to the first question as well. What is being done now is to use the expertise knowledge without having a thorough analysis and assessment, using the expertise knowledge and the information that is available to do some preparedness and contingency planning. But it cannot be as effective as we having that information of that assessment. So based on that, again, even if you have the preparedness plan and the contingency plan, most of the time you don't have adequate resources. So what you are doing is prioritizing. So you prioritize. Most of the time what happens is, okay, at least let me prepare the health facilities with some of the supplies, medicines as well, so that if someone is affected, then immediately that person would be able to have the services. If there is malnutrition, I will be able to do treatment before the child or the other person or adult even have more serious complications. You also do give training. There will be flooding. So you have to train people on first aid, so that when the flood comes, when people are affected, then there is a possibility of providing that immediate support. So I don't have any study on this one, especially for this specific. For the previous one, there are some studies that have documented that this preparedness has really saved lives and prevented some injuries as well. It might not be 100% perfect, but it produces some sort of support. For this one, maybe we might have to do further assessment to see, because we know that countries have made some efforts. They have prepared a plan, they have had a contingency plan, and they have do some contingency stockpiling. But we have to do some assessment to see what was really the impact of this intervention. Definitely it will have some impact, but it might not be to the satisfaction of everyone. I think I have attempted to answer the questions. Thank you.
Thank you very much, Dr. Solomon. And maybe for the last round of questions. But before I go to the last round of questions, I want to remind folks that this event is recorded and we will share the recording. Plus, we will also share the video plus the audio recording and sound bites, plus any resources that our guest speakers, our panelists have shared with us here. And remember, these panelists are sources. So Christophe will be reaching out in emails, and those folks who want to continue doing interviews with the sources, the panelists that we have, can reach out to Christophe directly, and we will link you up to the esteemed panelists that we have today. For our last round of questions, we have here Nuru from Mombasa, Kenya, who's saying there is extreme heat and folks suffering from heat rashes, especially the elderly getting strokes and also pneumonia. What can be done to help the coastal people of Mombasa and other coastal regions or towns around the world? That is one. And then we have one here which asks about collaborations. Does the meteorological departments, do they collaborate with health ministries so that they come up with timely and efficient interventions? Those are two questions. And one more from Helen Shikanda, if you allow me, directly to Dr. Solomon. Please explain more on the shellfish poisoning. Thank you.
Thank you so much, Tole. I'll take part of the one for collaboration between Med Services and the Health Ministry. As a regional organization, we work with National Med Services, and like I said, we conduct what we call climate outlook forums, where we also bring on board actors from national ministries for different sectors, including health, and we provide climate information for the upcoming season. They come up with expected impacts, and we support them to come up with mitigation strategies. And we realize that this interaction continues even within the season, and they get to get more information on evolving weather conditions. And we expect that from that information that they get, they're able to change their plans, especially in terms of interventions when they change. Thank you.
Thank you very much. Dr. Solomon?
Okay, thank you very much. Let me start with extreme heat in Mombasa. The preventive measures, especially the first thing is actually to understand, to know those who are vulnerable, especially the elderly and those who have health conditions like heart conditions. They have to avoid exposure to direct heat. And then the other thing is to rehydration, continuously to hydrate ourselves. So we have to take a lot of water, including bathing as well. But do not forget, before it is too late, if the situation is worsening and if the patient the condition continues to deteriorate, please seek medical treatment. There are medical treatments that can be provided. So the best way is, of course, to avoid the direct heat and then to keep yourself hydrated as much as possible. And of course, taking showers and pouring water so that to keep us cold as well. But make sure that if the situation deteriorates, take medical treatments as well. The shellfish poisoning, as I have mentioned earlier, because of El Nino, it was noted that it has increased. It is caused by consuming of shellfish, and the shellfish get it from specific types of algae. Algae is plants on the sea. So those algae, they produce these toxins, and the shellfish by taking these toxins, and when human beings are consuming the shellfish, then the poisoning can happen in different forms. So it has been noted that that type of algae and that poisoning is higher during El Nino because of the favorable ground for the growth of the algae, specific types of algae. Thank you.
Thank you very much, Dr. Solomon, Eunice, Mr. Rasa, and Adele. Before we call it a wrap, I'd like to remind you folks that on the chat, we have a link to the Internews Health Journalism Network, which is a fantastic network for health and science journalists. It comprises of colleagues from all over the world. So it's a very, very good network to join. And also on the chat, there is a tip sheet with great tips on how to cover this particular story. On behalf of ESAR RCCE Technical Working Group, Internews, the panelists, and all the organizers, I'd like to really thank you for taking your time and joining us for this rebooted media dialogue. We hope to see you soon. We will reach out when we have our next event. And please feel free to let us know what kind of topics, health topics or humanitarian thematic areas you'd like us to tackle moving forward. And thank you very much. And from wherever you are, good morning, good evening,